This is one segment of a series of presentations on each of the ballot measures for the November 3rd general election, brought to you by the League of Women Voters, Fremont, Newark, and Union City. I'm Ruth Narayan, a member of the League, and will present a brief overview of Prop 23 in this segment. There is a separate segment for your reference on how to evaluate a ballot measure, which I recommend you review as well. The League of Women Voters is a nonpartisan organization that promotes political responsibility through informed and active participation of citizens in government. It is important to emphasize that the League never supports or opposes any political party or candidate. However, the League does study issues on public policy and takes positions of support or opposition on some measures. You can find the League of Women position on their website listed in the references in the last slide. This presentation is about Prop 23, and it concerns the regulation of kidney dialysis clinics. Specifically, the measure establishes minimum staffing and other requirements. In the state of California, propositions can come either from the legislature or from the initiative process, and this is from the initiative process. To evaluate this proposition, it is important to understand what dialysis is. In order for people with kidney failure to survive, they must receive a kidney transplant or go on dialysis. Because of the lack of available donor kidneys, most will go on dialysis. And this is a process that uses a machine to filter the blood to remove waste, toxins, and excess water. It involves a small surgical procedure where a blood vessel is expanded in the patient's arm to provide access. During dialysis, blood is pumped through soft tubes to a dialysis machine where it goes through a special filter called a dialyzer. As the blood is filtered, it is returned to the bloodstream. Treatment is typically done in a chronic dialysis clinic 3 times a week, with each treatment lasting up to 4 hours. The lives of patients on dialysis can be extended for years. However, it is life-threatening to not receive the required schedule of dialysis 3 times a week. To address patients' needs, clinics often operate 6 days a week for extended hours. And this is what it looks like. As a retired public health nurse, I feel compelled to share with you that the major cause of kidney failure is poorly controlled high blood pressure and diabetes. And that's why it's very important for everyone to periodically have their blood pressure and blood sugar checked, and if they are out of control, to keep them well controlled. Kidney failure is usually a slowly progressive disease without symptoms. The ballot summary. This ballot requires that at least one licensed physician be on site during all hours when patients are receiving treatment. An exemption may be granted if no qualified physician is available, but a nurse practitioner or a physician's assistant must be on site. It requires clinics to report dialysis-related infection data to state and federal governments. It prohibits clinics from closing or reducing services without state approval. It also prohibits clinics from refusing treatment to patients based on their source of payment. Clinics are licensed by the California Department of Public Health. Federal certification standards are used to provide minimum safety guidelines. Federal licensing regulations for dialysis clinics require that each patient be visited by his or her physician at the clinic at least once a month. There is also a requirement that each clinic employ a medical director, and this position is estimated to be 1/4 time. That implies that one physician could rotate as medical director among several different clinics. There are about 588 licensed clinics in California. As of May 2018, approximately 80,000 people in California rely on dialysis clinics for treatment. 72% of all clinics are owned and operated by DaVita Incorporated and Fresenius Medical Care. These are private, for-profit companies. And it is estimated that the annual revenue of private companies is $3 billion. Payment for dialysis treatments come from a variety of sources, and these are sometimes intertwined. Medicare pays for most treatments. Medi-Cal also covers a portion of dialysis treatments for patients who are indigent and have no other health insurance. These government programs set reimbursement rates for dialysis treatments. Those rates are largely set by regulation and are close to the clinic operator's average cost for each treatment, which somewhat limits clinic operators' profit margins. The fiscal effect. Prop 23 would increase costs for clinics because a physician would have to be present during all treatment hours. These costs would be passed on to the current primary payers, Medicare and Medi-Cal. The legislative analyst estimates that costs to state and local governments could be tens of millions of dollars annually. The new data reporting requirements would not significantly increase costs. In 2018, Prop 8 also dealt with dialysis, but regarding a different issue. Prop 8 capped profits and required a refund to patients or patient payers, whereas Prop 23 addresses physician staffing, data reporting, and clinic closures. Both propositions were supported by the SEIU UHW West, a labor union for healthcare workers, and they reflect a conflict between the union and the state's two largest dialysis business, DaVita and Fresenius. Prop 8 was defeated by 60% of voters. Supporting arguments. Patients should have access to a physician on site whenever dialysis treatment is being provided. Proper reporting and transparency of the infection rate encourages clinics to improve quality. And strong protections should be provided to vulnerable patients when clinics close. Supporters and funders. The California for Kidney Dialysis Patient Protection is a political action committee funded solely by the Union Service Employees International Union United Healthcare Workers. It is noteworthy that the union hired a company, Petition, to collect signatures for this measure. A total of approximately $5.5 million was spent to collect the required 623,212 valid signatures to put this measure before the voters. And this results in a total cost per required signature of $8.86. Yes on Prop 23 has raised a little over $6 million. Prop 23 would make the opposing arguments. Prop 23 would make the physician shortage worse by diverting physicians to dialysis clinics, leaving hospitals and clinics without adequate physician staffing. Because of the increased financial cost involved in Prop 23, clinics would be forced to cut services, putting lives at risk. Dialysis clinics are strictly regulated and provide high-quality care. According to Dr. Jeffrey Perlmutter, president of the Renal Physicians Association, every dialysis patient is under the care of a physician kidney specialist, and dialysis treatments are administered by specially trained nurses and technicians. It makes no sense to require physician administrators on site full-time. Furthermore, he says, this physician is not required to be specially trained in dialysis care. According to the Federal Centers of Medicare and Medicaid Services, California dialysis clinics outperform other states in clinical quality and patient satisfaction. No on Prop 23. Stop the dangerous and costly dialysis proposition. This is a political action committee. In addition to opposition by DaVita and Fresenius Medical Care, there is a long list of organizations that oppose this proposition. Major ones include California Medical Association, Nurses Association, the Academy of Nephrology Physicians Assistant, the California State Conference of the NAACP. And the list of organizations can be found on the website listed on this slide. The total money raised is over $73 million, mostly by dialysis corporations. Thank you for watching this presentation and for being involved in our democratic process. If you want further information about the elections, these are some nonpartisan websites. Thank you again.